Where my ladies, where my ladies, where my ladies, where my ladies. Open my door 'cause I'm a lady. Check my code 'cause
Hello, and welcome to another episode of the Whole Woman Within Talk Show. I'm your host, Lady Barbara Thompson. Well, today I have a very special guest in the studio with me. She is all the way from Jacksonville, Florida. Her name is Mrs. Sonya Dunbar, and she is a geriatric tooth fairy, y'all. Yes, and I'm gonna let her tell us first a little bit about herself, and then she's gonna explain this geriatric tooth fairy to us. Okay, Miss Sonya, welcome.
Thank you so much, Ms. Barbara. I'm so excited to be on your show.
Thank you.
I'm so excited for what you're doing for women. So thank you for having me as a guest.
Thank you.
Again, my name is Sonya Dunbar, and I'm affectionately known as a geriatric tooth fairy. I've been a dental hygienist, a proud dental hygienist for over 31 years.
Wow.
And for the last 18 years, I focused only on seniors, hence the name Geriatric Tooth Fairy. I've worked in long-term care facilities, assisted living facilities, group homes, and yes, I've even gone into people's homes that are homebound, that are seniors, to provide the well-needed and the much-needed oral care. So that's why I got the name Geriatric Tooth Fairy, and I can't wait to unwrap this on your show.
I love it. I love it. And when she says geriatric, you know, with these medical terms,
Yes,
sometimes you got pediatric, but we just want to let you know that that's our seniors. She mentioned the word seniors. So she is affectionately active about our seniors. That's, you can say older people. That's our older folks. Yes, yes. We want to make sure that they have proper dental hygiene, which is so important.
Absolutely. And I just like to comment, because I do hear a lot of people say, well, I'm 65 years old. Am I geriatric? No. Geriatric means someone that's older with comorbidities, with many sicknesses. So just because someone may be 65 or 75 or 80 does not mean they're geriatric. Geriatric means an older person that is ill or sick. So most of the people in nursing homes, matter of fact, all the people that live in nursing homes that are that's over a certain age, those are called geriatric people. Now, we do have people that live in nursing homes that are 30 and 40. They might not be geriatric, but if someone is older and they're sick, they're geriatric. So my special niche is for older people who need special care. They may be bed bound, they may have diabetes, they may have a leg amputated, a number of reasons why they're sick. So that's what geriatric comes from. Does that make sense?
Yes, that does.
Perfect.
She explained that so well. She's working on her PhD, y'all. Okay? So you can see she's full of knowledge and full of information, and I love that because, as you know, I'm a nurse, and my background is geriatric also, yes, for 30 years. And I love that age category. I love the nursing home patients, and so many times they really need that. But I did hear you say you go into homes also.
Yes, you know what, a man called me. He was not very old. He had MS, 56 years old, bedbound, and we work in Florida and Georgia. He went to his state rep. He called his state representative because he needed to just get his teeth cleaned. And for him to get an ambulance to take him to the dentist, because he was paralyzed from the neck down, was a $500 ride. So, and for a dentist to come to his home, it was like $800 or $900. So the state representative reached out to our company, and we went in and provided the care for them. So we do go to homebound people. I've gone to a lot of people who live in dependent housing, assisted living housing. They have their own little apartment, and we provide dental care there. Because you being a nurse, you know how the mouth and body is connected. If your mouth isn't healthy, your whole body isn't healthy. There's so many diseases linked to your mouth.
Absolutely.
Diabetes, heart disease, cancer, arthritis. There's so many diseases. The mouth affects your whole body. Think about it like this. There's only so many ways infection can get into your body. Your ears, your eyes, or your other open areas. And we all know what we're talking about. But the mouth is the biggest open area. So if you have bacteria in your mouth, if plaque and debris is in your mouth, and you're swallowing that bacteria in your body, it goes into, it affects your whole body. So, and especially for the older people, if they're already compromised with other sicknesses, and if their mouth isn't healthy, then it makes them go down quicker. Does that make sense?
It makes sense. Yes, it does. And you know what I said? If I had a chance to do one thing over in my life, I'd take better care of my teeth. Even from youth being up, you know, because I've had some feelings, and I hate to go to the dentist, but I have a good dentist, okay? So the last time I went to the dentist, I was on pins and needles. That's when I do most of my interceding. Man, I'm telling you, I be praying like crazy because I hate that needle. But anyway, the last time I went to the dentist, it was such a wonderful experience. I couldn't believe it. I told my dentist, I say, how do you go to the dentist and it's a wonderful experience? But as a youth, I'm just saying, even our young people, they need to know how to take care of their mouths and their teeth, you know, and their hygiene. So,
and thank you for saying that. And I want to, can I put a pin right here?
Go ahead.
We just got the contract with the Head Start in Jacksonville, Florida.
Okay.
So we're bridging the gap from 2
Cedar.
to 102.
Okay.
But let me tell you why this is important. I worked for Crest in 2021, and I was speaking on diversity and inclusion. And I'm going to tell you something. And what you said, this is what I'm saying. It's the average age of a black child first dentist appointment. The average age is 13 years old.
Okay.
Their first dental visit is at the age of 13, and it's because they have pain. So this is why you're saying you're scared. The average Hispanic child first dental visit is age 16 because of the pain factor. And their first visit is probably for a filling, and it's gonna hurt. The average white child goes to the dentist when they're 2 years old.
Okay.
They're sitting on their mama lap. They got the little spinny thing. It's just a first time fun visit.
Wow.
This is why, and you're a adult saying that you're scared of the dentist. The dentist doesn't try to hurt people.
Right.
We numb you. We put numbing on before we have to give you the needle, because you do have to get a shot. But we numb it. We can ice it. We try to distract you. But if you're already on pins and needles, that's going to heighten the pain.
Absolutely.
Parents tell kids, you're going to go to the dentist. It's not going to hurt. The kid going to put in their mind, it's going to hurt.
Okay.
And so pain is automatically associated with dental care, and it shouldn't be.
Shouldn't be.
White people don't have that with their kids.
Okay.
The average white child, like I said, when I worked in those high-end offices where white people own it, those kids come to the dentist at 2 years old.
Wow.
So when they get their first tooth, and they sitting on the mama's lap, and they're just laughing. That's why I'm so glad that we got the contract with Head Starts. We're not so much cleaning the kids' teeth, because the kids in Head Start are mostly in underserved communities.
Okay.
Because it's an income-based schooling. We're not so much cleaning their teeth because their teeth probably don't have anything on it. But what we're doing is giving them a friendly visit with the dentist. Wow. We have toys, we're laughing with them. We're letting them know that the dentist is your friend. Because you have to develop those habits young. We need to take our children to the dentist the first time they get their tooth, and sit them on your lap, the mom or dad, and say, hey, or grandparent, a lot of grandparents raise the kids now. Sitting on your lap and say, the dentist is your friend. They get to smell the smell, hear the sounds. The dentist will let them hold a little spin thing, and even let them taste the prophy paste, the little stuff.
Yes.
That's the first visit. Even the second visit may be like that. But don't tell your kids you're going to go to the dentist, it's going to hurt. Because that develops a lifetime of bad habits.
Yes.
And you know how important our teeth are.
Right.
And it's the bacteria. Now, can I plug this in?
Go ahead. Yes.
Okay, here it is.
Okay.
When you brush your teeth, when I was a little kid, the little yellow stuff used to be on our teeth. You could scratch your teeth. You used to call it butter. That's plaque. That we call it butter. That's plaque.
Right. It's plaque.
That grows on your teeth. Soon as you brush your teeth, the plaque comes back.
Right.
But if you don't brush your teeth and if you don't floss, now flossing is more important than brushing.
Okay.
Hard.
Right.
Once the plaque is hard, it's tartar.
Okay.
You cannot remove tartar. The teeth is hard as bone. That plaque and that tartar eats away at the bone that holds your teeth in. This is why people lose all of their teeth. Because the plaque gets hard, the hard tartar. Once the plaque is hard, it's tartar, and it has a bacteria that's called gum disease, which is pyorrhea, periodontal disease. That periodontal disease eats away at the bone to hold your teeth in.
Wow.
If you think about it, most people don't get a lot of cavities and they lose their teeth.
Right.
What makes people lose all of their teeth is gum disease. It makes your teeth loose.
Wow.
Now, here's where the problem is. If that plaque and tartar is strong enough to eat away a bone, what is it doing to your body every time you swallow it?
Wow.
It gets into your heart. It's caused heart disease.
Yes, yes.
It makes diabetes worse.
Yes.
It causes urinary tract infections. It causes cancer. It makes arthritis worse. Gum disease, it makes blood pressure worse.
Okay.
That gum disease, when you swallow it, infects your whole body.
Right.
It infects your whole body.
Sound like it affects.
So
every organ.
Yes, ma'am.
Yes,
Because you swallow it in your system.
Right.
And so older people, a lot of them go to the hospital from aspiration pneumonia. They swallow that plaque and it gets in their lungs. And they not walking around like we do,
Right.
so they can't kick that bacteria out. When you walk around, you open and close your lungs. Well, if someone is stationary in their bed or in a wheelchair, they're not able to kick that black plaque and bacteria out,
Wow.
and it makes them get pneumonia, and a lot of times it kills them. So oral care is important. If your mouth is not healthy, your whole body isn't healthy.
Right.
So my specialty, my gift from God, that God gave me, because my grandmother was in a nursing home,
Okay.
and my grandmother was my best friend,
Okay.
and that's what started my journey.
Oh.
Do I have enough time to get into this?
Go ahead.
Do I have enough time? Do you want to hear this? Come on, should I
Tell us.
Okay, so here's how it got started. My grandmother, you know, was like my best friend. You know, I loved her so much. When I got my first car at 16, I would have picked up my grandmother.
Oh.
We went to a place called Duff's. She had dentures in. It was a buffet. She ate too much. She threw up, and her dentures got put in the dumpster. I was dumpster diving for my grandmother.
goodness.
That's how close we were.
Okay.
She came and she moved to Florida. She lived with me. She was from Michigan.
Okay.
They put my grandmother in a like a nursing home, and I would go see her every morning.
Okay.
And then I noticed that they weren't taking care of her dentures.
Okay.
The staff didn't know how to take them out and brush them. They didn't know how to take care of her mouth.
Okay.
So I started doing my own grandmother's teeth, and her roommate was like, no one was brushing her teeth. She had real
Okay.
teeth. She said, will you brush my teeth? They don't come out like your grandmother's.
Oh.
So I went and looked in her drawer. I didn't see a brush. I looked in the bathroom. I didn't see one in there. I went to the nurse's station. I said, is there a brush here? She was like, we don't have any.
Oh.
So I went out and bought her one. And I started brushing her teeth. Now,
They didn't have a toothbrush?
No, not in the whole facility.
Wow. Okay.
My grandmother, I went and bought her a little toothbrush and a little kit, and I would brush her teeth every day. My grandmother had diabetes and congestive heart failure.
Okay.
And she would ask me, bring me some cigarettes. I said, Grandma, you got oxygen on your tank. You gonna blow this joint up. I'm not bringing you no cigarettes. You gonna blow this joint up. So every day I would go see my grandmother. It was another person, another senior that lived in the nursing home would come in with their bag or with their teeth in their hand, and they wanted me to brush and floss their
Okay.
teeth. So I was going out and buying little kits for
wow.
everybody.
Okay.
So it was like 4 or 5 people coming. Every day my grandmother would ask me for cigarettes. I'm not giving you any. So one day I went, and it was a line of people outside her door. They had walkers and wheelchairs,
Wow.
and they wanted me to, it was like 15
The
people.
word had gotten around.
It looked
Oh,
like a
my
geriatric
goodness.
parade, okay? And I went in the room, I was like, where's my grandma? My grandmother wasn't in the room.
Where was she?
She was out in the courtyard,
Doing what?
smoking.
That's what I figured. Okay.
And I said, Medea, we called her Medea for Mother's Day. I said, Medea, how did you get here? What's going on? And where you get those cigarettes?
Okay.
She said, I told people that if you give me 2 cigarettes,
Stop.
my granddaughter would clean your teeth.
Stop.
I said, so you was, she was pimping me out. I'm like, my grandmama was the first entrepreneur in the family, right? So my grandmother ended up transitioning.
Oh.
But that started me out on the journey.
Yes,
Okay?
yes,
I knew there was a need in the long-term care
Yes.
facilities. And that's how I got started.
Wow.
That's how I got started. I started doing it for free.
Wow.
But I do believe that your vision, if you give it to God, will do what?
Right.
Make room for
Yes,
you.
it will.
And
Yes.
that's how we started out with the
Right.
business.
Now, you and your husband also have a mobile transportation. I read that somewhere when I was reading about
Yes.
your background.
Yes.
So, do you guys work? He worked with you?
Yeah, my husband, Gerald Dunbar, my whole world.
Okay.
We're when I was doing it for free, I said, baby, I would like to start a business like this. And
Okay.
he took all of his retirement, and we got everything together. We started our own mobile dental practice. So
Okay.
he's the president of the company,
Okay.
and we work together.
Wow, wonderful.
I'll go into more details.
Okay, we're here with the Geriatric Tooth Fairy today, and we're going to take a break, and we'll be right back after this moment, okay? Thank you. Hi, and if you would like to buy any of my products, my shea butter, which is a great moisturizer, a skin moisturizer, or a hair moisturizer, just go to my website, thehouseofdreams.com. That is dreams with a Z, DREAMZ, thehouseofdreams.com. There you will find my products, my shea butter, my sweet potato pies. And all right, and we're back with our Geriatric Tooth Fairy today, and she is giving us a lot of nuggets, a lot of education, and I hope you guys are enjoying this, and make sure you're taking some notes, because I'm telling you, she's giving us a lot of information. All right, thank you again, Miss Sonya, and I want to ask you a little bit about your husband, I know you guys have the mobile service. How does he help you in this area?
And so we're partners in this together.
Yes, ma'am.
Yes, and he's the president of the company.
Okay.
So I handle the clinical and he handles all the administrative part, all the contracts, all the financial, all the legal. He handles all that and I handle all the clinical because I'm the dental hygienist. I'm the clinical part. So yes, he's that part of the company and he works very well with me and we are dynamic duo together.
I bet. Wow.
Yes.
It looked like anyone working with you would have a whole lot of fun.
Thank
because
you.
your energy is just way up there, and that is great. Yeah, I just want to talk about from a nurse perspective. We were talking about the diseases, and yes, so the gum disease is very real when it comes to affecting a lot of parts of our bodies, because I have this person that was supposed to, my girlfriend, her husband was supposed to have knee surgery, and she was telling me that they couldn't do the knee surgery until they gave him antibiotics for his mouth. And someone was in the car with us and they said, well, why, with him having knee surgery, does that have anything to do with the dental work? And being a nurse, I was able to tell her that if he has dental or gum disease, that could affect the heart, and they're not going to operate on you if there's something wrong with the heart. So a lot of times, you know, we have to get antibiotics and we have to clear up the gum diseases before you can have a certain type of surgery. Is that right, doctor?
Absolutely. And one thing I want to say about that, I'm gonna give 2 tips here.
Okay.
As a geriatric tooth fairy, I'm gonna give you 2 tips. One tip I'm gonna give you is, if your, first of all, teeth don't bleed, your gums bleed.
Okay.
So people say, my teeth bleed. Teeth don't bleed, your gums bleed. If your gums bleed, it's a sign of disease. You need to see the dentist. If you brush your teeth and you spit in the sink and it's pink, that's a problem. Think about it like this. If you rub your eye and that eye start bleeding, you on the way to the hospital.
Okay.
You're gonna see somebody. So why do we let our gums bleed? Bleeding is never good. So when you brush your teeth, if you have gum disease, if bleeding is a sign of disease, first of all, it's an early sign. Okay. But if you brush your teeth and it's bleeding, that means the gums are open. So if you have that plaque and bacteria, that plaque and bacteria goes right into your heart. And that's where the problem lies.
Yes,
that is not healthy.
Right.
That is
absolutely.
not healthy. Tip number 2 I'm gonna give. If you have dentures, you should never ever sleep in your dentures.
Okay.
Because the same plaque that grows on teeth grows on dentures. So when you should, so if you have dentures in your mouth and there's plaque on it because you've eaten pieces of food, when we sleep, we breathe deep. We breathe bacteria in our lungs, and you can get pneumonia from that, and that can cause a lot of pain, especially for elderly people. They should always remove their dentures when they sleep. Tip 2. You should never brush first of all, you always need to brush your dentures. Some people take their dentures out and put them in a cup. Right. You need to brush them because that plaque and food is on them, and then you put them in a cup with some solution. But you should never ever brush your dentures with toothpaste because your dentures are not teeth. Toothpaste are abrasive. They have stuff in there for whitening and they have abrasive in it. Teeth are hard. Our teeth are hard, but dentures are acrylic, and when you brush your dentures with toothpaste, you put little cracks in it and bacteria grows in there and it has an odor. So sometimes if you wear dentures and you notice your breath smells all the time, it's because you have little small cracks in there, and because when you close your mouth, it's a dark, warm, moist environment, bacteria grows.
Well, what do you brush your dentures with?
You can use soap, you can use dishwasher liquid, or you can use denture toothpaste.
Wow.
Now I have and nobody's paying me to say this, but I do, when I go in the nursing homes, the only thing we use on our patients is Dr. Berlin. Dr. Berlin, B-E-R-L-A-N-D. He has a toothpaste that's all natural, vitamin A, D, B, tea tree oil. It's amazing. Okay. And you can buy that online at Amazon, but that's what I would use if I had dentures. But these are my real teeth. But if I had dentures,
and they're beautiful.
And
oh my God.
Can I give one more tip?
Go ahead.
Like I said, you should never sleep in your dentures. You should never sleep in your dentures because, like I said, your mouth is a warm, moist, dark environment, and bacteria grows, and it's not good. Your gums need to breathe. Sleeping in your dentures is equivalent to having gym shoes on all day in the rain, and your feet get musty, warm, and wet, and you sleep in them.
Wow.
So we should always remove our dentures. So that's just a tip from the Geriatric Tooth Fairy. If you get a cold, and then you're going to relate to this.
Okay.
The day you get a cold, throw away your toothbrush.
Okay.
Why am I saying that, Miss Barbara?
Because of the germs and the bacteria.
Absolutely.
Yes.
If you get sick, throw away your toothbrush. Go to the dollar store. Get a whole bunch of dollar brushes. Because if you keep brushing your teeth with the same toothbrush, you just keep reinfecting yourself. So the smart addict saying, I run under hot water. You know hot water not getting all that cold that you coughing up off that brush.
Okay.
So just get some dollar brushes and change your brush every day.
Wow.
Some people have the flu longer because they keep using the same brush. If you get a cold, especially if you have an electric brush, but that's a whole different story. We got to come back on. People use the same brush, but you keep reinfecting yourself. Put your brush down, get some little cheapies, and brush your teeth with a different brush every day.
Okay.
Perfect, right?
Right, that sounds good.
That makes sense?
Yeah, and let me just ask you, so if you don't have a cold or flu or whatever, how often should we change our toothbrushes naturally,
Thank you for asking me that.
Yes, ma'am.
Because there are some people who only get a new brush when they go to the dentist. And that's every 6 months. Now, personally, if it was me, and now a lot of people may not agree with this, but thank you for bringing that up. I would change my toothbrush every 2 months, 2 to 3 months.
Okay.
I personally change mine every month, but there you go.
Okay.
But here's something I want to tell you. Cover your toothbrush up.
Okay.
Cover it up. Because
Okay.
every time you flush your toilet, that toilet sprays so far.
Okay.
And those bacteria get on that brush.
Wow.
Everything that's in the air
Okay.
sparkle down on your brush. And what you do with that brush, put it where?
Right in your mouth. Wow.
Cover your brush up. Get a cover with little holes in it so it can breathe. They have all type of but always cover your brush. That makes sense?
That makes so
Give
much
us some tips from the Tooth Fairy,
you're
okay?
giving great
I'll give us some
tips.
little nuggets,
Yes,
right?
from the Geriatric Tooth Fairy. You're giving great tips because I don't cover mine. I'll have to confess to that. I don't cover.
Doesn't make sense though. You're a
It makes
nurse.
sense.
You're a nurse.
Absolutely. But you're the expert with this. So
Right.
I'm listening and I'm going to start covering mine. I'm going to change it every 2 months because I'm one of those people that change it when I go to the dentist and I get the new one. So every 2 months, I'm going to start changing my toothbrush. I want to ask you this. What about brushing your teeth at night? Because I know some people brush their teeth in the morning and they don't brush them again at night. What's your take on that?
Thank you for asking me.
Yes.
A couple things I want to say about that. You eat all day.
Yes.
You eat all
Some of
day.
us.
You eat, and you eat chicken or something like that, and it may be a little piece of chicken stuck in the back of your mouth, in your tooth, because you're not brushing at night.
Okay.
You close your mouth and go to sleep. Like I said, the mouth is a warm, moist, dark environment. So you have roadkill. You have flesh rotting in your mouth. If you don't brush your teeth at night, that's when the bacteria grow. That's why people have morning bad breath. If you brush your teeth at night, your breath will be fresher in the morning.
Wow.
I tell people, if you only gonna brush once a day, brush at night.
Okay.
Because that's where all the activity is happening. And everything that you've done with your mouth all day is resting in your mouth overnight. So it's so important that we brush our teeth at night.
Okay.
And here's the thing. Brush your tongue.
Yes.
Can I talk about the tongue for one second? Y'all don't got me going down there.
I learned that years ago to brush my tongue.
Now,
Yes.
here's the thing. Your tongue is a sponge. It's like it has all these little bristles on it. It's a sponge. So if you're not brushing your tongue, all of that bacteria is laying on your tongue. Now, there's 2 tips I'm going to give you here. First, don't brush your teeth and then brush your tongue.
Okay.
Because all you're doing is taking the bacteria off your teeth and putting it on your tongue. Smart aleck on there saying, well, I'm going to brush my tongue first. You're taking the bacteria off your tongue and putting it on your teeth. So always, first of all, if you're going to brush your teeth with a brush, get a separate brush than what you're doing with your teeth. But I always recommend a tongue scraper.
Okay, I have
You
one
take
of
a
those.
tongue scraper and scrape the bacteria off your tongue. Because if you brushing your tongue, if you're not brushing it out, you're just brushing it back and forth, and you're just storing up all that bacteria. It's like a soup bowl of bacteria.
Right.
So if you're brushing it, you're really not removing it. You're brushing it around.
Okay.
That makes sense?
Yes,
You take a
yes.
tongue scraper, it comes off. Now, anybody don't believe me? Next time y'all go out, get one of them black plastic sporks, black plastic spoon. the disposable one. Take it and scrape it across your tongue to see all that stuff to come off your tongue.
Okay.
Your tongue holds so many bacteria.
Right.
Google it. I have a YouTube on tongue cleaning. There's so many bacteria on the tongue. There's some good bacteria, there's a lot of bad. So cleaning the tongue is so important.
Right. So let me ask you this. So for people who may not have a tongue scraper, because I do have one, would we want to use 2 separate toothbrushes? Because you said don't use the same one that you brush your teeth with. So how would they do that if they don't have the tongue scraper?
Well, oftentimes, first of all, if you're going to use a toothbrush, make sure you brush out. Don't brush back and forth. Brush out.
Brush it out.
Brush
Okay.
out.
Okay.
Does it make sense? Brush out. And then you can use the back of your brush. A lot of times the back of the brush has those ridges on it. That's what it's for.
Okay.
So if you can buy like a good brush, like an Oral-B,
Okay.
you know, with the bristles on the back, they have little things on the back. You can brush the back of the tongue.
Okay,
You
with
can
that.
clean it and clean it out.
Okay.
That makes sense?
That makes sense.
Perfect.
Or 2 separate toothbrushes.
Yeah, or 2 separate brushes.
Okay, okay.
But if you
Don't
use the brush,
same
brush it
one.
out. Yeah.
Okay, just
Yeah.
don't use, because I do have the scraper, but I don't like it, so I haven't been using it
Some
that
people
much.
gag with it.
Yeah, I don't like it. But I have been using the same toothbrush, so I have to make sure I get a separate toothbrush to brush my tongue. But I've been brushing my tongue for years because I learned that in a women's meeting, we were having a women's meeting, and the young lady worked for a dentist, and so she was saying it. But it kind of gags you when you first start doing it.
Yes.
Yes, but it's healthy for you. All right, now let me see. You have a book, right?
Yes.
Okay, tell me a little bit about this book, Miss Sonya.
Well, I actually have 2 books.
Oh, 2,
The first
okay.
one is Golden Nuggets of Life.
Okay.
It's an amazing short story, and it's on Amazon and it's on Alexa.
Okay.
And then you can go to Alexa and say Golden Nuggets for Life by Sonya Dunbar.
Oh.
And it's 28 short stories.
Wow.
And it's so amazing that people told me while I was in a nursing home, that all the stories in there are true.
Okay.
It's a quick read and it's a fun read.
Okay.
There's so many nuggets in the walls of those nursing homes.
Okay.
And they just die away with people.
Wow.
And the second book is The Tooth and Nothing But the Truth. And it's everything you want to know, right? That's adorable.
Okay.
It's everything you want to know about oral care for seniors from A to Z. It even has color pictures in it, and it's an amazing book. I wrote it in tangent with a geriatric dentist that lives in New York. So it's an amazing book, and it's also available on Amazon.
Okay.
So those are my 2 books out. The other book is How to Start a Mobile Dental Practice, but those are the main 2 books.
Okay, all right, wonderful. I love it. I am enjoying this. This is just, oh my God, so much information that's really needed for, would you have any advice for our young people when it comes to their teeth? Maybe the teenagers, or, just any advice for them at all?
Yes, first of
Okay.
all, I want to say for the teenagers, it's so important to brush your teeth every morning and every night. And gum disease is contagious. So if you kissing somebody, because we know
Okay.
teenagers gonna kiss,
Yes.
and they have gum disease, they can give you gum disease.
Oh,
So
wow.
gum disease is contagious. So if you get your first little boyfriend and girlfriend, you want to let them know, hey babe, brush your teeth and don't forget that tongue.
Okay.
You know what I'm saying? Throw that tongue in there. So it's important to develop healthy habits of young people. It's important to go to your dentist twice a year and have that relationship with your dentist. And I want to tell you now, if your gums bleed, it's not good. It's not normal. Is that fair?
Yes, that's fair. That
And that's the
sounds
tip that I would tell our young
Okay,
people,
great,
you know?
Great. Well, I wanted to say too, as a nurse, I started taking my daughters to the dentist at the age of 5. So I had the insurance, because a lot of times people don't have insurance and they can't afford the dentist unless, I guess, they're on some type of program. But I have a daughter that's, she's late up in age, but she's never had a cavity, and she's got 4 children, because usually when women start having children, it pulls the calcium from our teeth.
Absolutely.
But I have 2, and I think the other one only has 1 cavity. And I told them, do the same thing for my grandchildren. I say take them to the dentist every 6 months. Make sure they get their cleaning. It is so important. Like I said, when I was a child, I didn't have that privilege. I don't even know if my mom knew anything about a dentist. That was back in the day. But I would recommend great good dental hygiene. It is so important. It is so important for you in life, okay? So now we're gonna let the Geriatric Tooth Fairy wrap it up for us. You want to give information about your website or how people can reach you. If you can go ahead and give us that information, we're gonna bring the show to an end, and I have enjoyed it. I feel like we need to keep going, but it's time to bring it to an end. So is there anything you'd like to say to us to close it out and give us information how they can reach you? I've heard you say, I don't know if you gave the name of your website.
Yeah.
But go ahead and give that information.
Well, first of all, I want to say I enjoy being here, and I really appreciate you, Lady Barbara Thompson, for having me on your show. But I did want to say one thing. You said about insurance. If you do not have insurance, there's always dental schools. Those dental students are looking for patients because they have to have so many to graduate, and they're going to do a great job, and if they don't do a good job, their professor is going to do it. If you need cleanings, dental hygiene schools, they're always looking to do free cleanings or $3 to $4. So if you don't have dental insurance, you could always go to the schools. Just remember that. If you pass it along, in every city there's always not always dental schools, but dental hygiene schools. So you can definitely look into that and find out. Listen, my name is Sonya Dunbar. I'm affectionately known as the Geriatric Tooth Fairy. My website is sonyadunbar.com. Follow me on all my handles. Instagram is that geriatric _ tooth fairy. LinkedIn, Sonya Dunbar. Facebook, that Geriatric Tooth Fairy. And listen, take care of yourself. Take care of your mouth. Take care of your teeth. God bless. Have a great day.
Wow, thank you. You are so amazing, Miss Geriatric Tooth Fairy. You are so amazing. I'm so glad. We were trying to do this in July, August, and see, November is the month. So God knew that you needed to be right here in November because this is the month for geriatric, and the 9th of November was
Geriatric Tooth Fairy Day.
Yes, and that's all because of you. So I am so excited that she was here. I just want to say thank you again. I have enjoyed myself. Definitely want to have you back again. Absolutely. And I just want to thank you for watching this show, and just want to let you know that you are watching the Whole Woman Within episode, and just want to let you know no matter what you have gone through in your life, you are able to come through as a whole woman within with nothing missing, nothing lacking, and nothing broken. I will see you next time. Hi, and if you would like to buy any of my products, my shea butter, which is a great moisturizer, a skin moisturizer, or a hair moisturizer, just go to my website, thehouseofdreams.com. That is dreams with a Z, DREAMZ, thehouseofdreams.com. There you will find my products, my shea butter, my sweet potato pies, and my books. Thank you.